Next, you have your antihypertensives. We know that these decrease the blood pressure. Um, the meds, the diuretics decrease the volume and increase urine. Monitor the potassium level with these. Beta blockers, your ACE inhibitors. The meds can be like the calcium channel blockers. Then you have your diuretics. Diuretics are you may have like your potassium wasting, which is like the Lasix, and then you have your potassium sparing, which is like the Aldostone. You want to increase this, you know that it's going to increase your urine that you excrete. So you want to tell them to increase their fluid so that, they won't lose too much and be dehydrated. It decreases the fluid volume, decreases the blood pressure, and these are the drugs, like I said, like the Diazide, Lasix, and Bumex. Meds that affect the blood, you have the anticoagulants, the coagulants, blood products, vitamins, iron replacement. Meds for allergies is antihistamines. That can be like a Benadryl or a corticosteroid. And they're used basically just, like I said, for allergies. Decongestants, they can also be used for decongestants. Bronchodilators, you have your epinephrine, and they treat asthma, bronchitis, and they relax the smooth muscle of the trachea and the bronchial tree. They dilate the size of the lumen and open up the airway, and this relieves the symptoms. You need to monitor their vital signs: increased heart rate, dizziness, tremors, and respirations. Respiratory stimulants. Deeper, it makes them have deeper respirations. They increase the rate of respirations, and they act on the medulla of the brain. And they sometimes can cause respiratory depression. To reverse this agent, you can use Narcan if they have like an allergic reaction. Antitussives, they relieve cough. You have your narcotic and non-narcotic. The narcotic is for short-term use. It causes constipation and it can be habit-forming. This is like your Robitussin, codeine, high codeine, and morphine. The non-narcotic is the less effective, and it's the dextromethorphan. Is DEXTROMETHORPHAN. And that's your cough and cold meds that are over the counter, like the Benadryl. And when you're thinking of a cough, you want to know how the cough is. Is it productive or non-productive? Remember, the productive cough is they're bringing up some secretions when they cough. Non-productive is just a dry, irritating type cough. Expectorants. This is like your Robitussin, Tussin, and Mucin. These meds, they liquefy secretions. They're easier to cough up and expel mucus. You want to monitor whether the patient is taking them with lots of water to reduce the thickness of secretions. We learned that was a priority, making sure they loosen those secretions before they even think about taking the med, because if they don't loosen them, they can't get the med down. Antihistamine is like the Zyrtex. I already said the Benadryl, Allegra, Tavis, and I already told you what it was for. They could relieve allergic reactions like itching, whatever. You got stung by something you were allergic to, something like that. Decongestants. They reduce swelling and opening of the nasal passages. Um, they increase the heart rate, and you don't want to use these in people with hypertension. These meds come in liquids, tablets, and nasal sprays, and you can only use the spray for 3 days. Mouthwash, very potent germ killers. Oral hygiene is most effective form of mouth care. It removes the mucus from mouth to throat and helps with halitosis, which is bad breath. Swish and swallow treats oral yeast infections. Stannous fluoride helps to prevent tooth decay. Okay, for your stomach, you can use antacids, which is for an upset stomach, and you want to take it 2 to 3 hours after another med because the absorption with the other med can alter that other med's absorption. H2 antagonists, they treat ulcer, gastric reflux, and ulcers. This is like with Zantac. Proton pump inhibitors treat GERD. Anti-flatulence, they treat flatus, which is gas. Antispasmodics, they treat GI mobility. Meds to stop vomiting is antiemetics, and this could be like, one could be like stop vertigo and nausea and vomiting is the Dramamine. Then you can stop hiccups or nausea and vomiting with Compazine. Zofran is nausea and vomiting associated with chemo, like chemotherapy. Phenergan, you can give it slow with Z-Track method or whatever, but it helps with nausea and vomiting. Monitor their electrolyte imbalances with nausea and vomiting in their eyes and nose and vital signs. Meds that affect intestine cathartics. You have your bulk producing. It increases the bulk and stimulates peristalsis and cause fecal impaction. These are meds such as Metamucil, and you need to give them adequate fluids with this type of med. Irritant cathartics irritates the large intestines and increases peristalsis, and these are meds such as Castrol. Lubricant cathartic softens the feces, so you won't have to strain. These are meds such as mineral oil with vitamin A, D, E, and K, and you give these between meals and bedtimes. Saline cathartics, bone prep before surgery, and it causes water retention by osmosis. These are things such as like the Golightly, Miralax, and they must be taken 3 hours, within 3 hours. And it totally empties the bowel and stimulates the smooth muscles to contract, and they empty really rapidly. And this could be like your fleet enema or something like that.